Hi, my name is Brittany Whiters, and I am the CEO and co-founder of Canna Health Digital Magazine, which is a free online publication that emphasizes knowledge, safe access, and advocacy. And I have the very special privilege today of moderating a panel called Pain, PTSD, and Opioids. And so let me tell you a little bit about the panel, and then I will introduce our amazing panelists who are very active in the community of cannabis wellness. So opioids are a class of like analgesic medication, which is they are medicines that are prescribed for pain and pain management. Um, However, since the legalization of cannabis, the use of opioids for pain management has actually decreased. And patients are more often turning to cannabis um, to facilitate their needs when it comes to pain management. And our panelists are going to talk a little bit more about that connection of pain and opioids and cannabis and how basically cannabis works in that space. We're also going to be discussing PTSD. Now, PTSD is a disorder that results from like a poor stress response that yields like a maladaptive memory process. And so what happens is, people, they have like a lot of symptoms, insomnia, difficulties coping with a normal life, and there are different extremes of PTSD. However, clinical trials have shown us that cannabis actually can help patients cope better with the symptoms of PTSD. And of course, our wonderful panelists are going to be discussing that as well. So with further ado, let me introduce our panelists that are on the are on the panel of pain, PTSD, and opioids. So we have Ms. Kebra Smith Bolden. She is a practicing RN and has been since 2011. Prior to that, she was an LPN for 7 years. After years of experience as a psychiatric nurse, she founded the first cannabis clinic owned by a woman of color, Canna Health, trademark. So while she cares for an array of patients, her passion lies with the health promotion of patients battling PTSD and chronic diseases. She is also the Chief Health Policy Consultant at Green Governance Health and co-founded and is now the president of CURE, which is Connecticut United for Reform and Equity. Hashtag Black Girl Magic. So thank you, Kebra, for being here today. We appreciate it. And now we have Dr. Swathi. Dr. Swathi is a pharmacist specializing in integrative health and cannabis. While she is a newcomer to the cannabis wellness space, she is making tremendous strides in facilitating and communicating with, while she is a newcomer to the cannabis wellness space, she is making tremendous strides in facilitating open communication between provider and patients, as well as implementing college curricula on medicinal cannabis and holistic care. She serves as a bilingual medical consultant for CBD and hemp companies. She's a clinical researcher, a natural medicine educator, and a content contributor for print and online publications. And we also extend our warmest congratulations on her recent accolade as she accepted the position as the Chief Pharmacy Officer at Calithos. Did I pronounce that correct? Calithos? Mm-hmm. Thank you for being here.
Oh, thank you.
And certainly last but not least, the gentleman of our group, Dr. Jonathan Smith, is a board certified anesthesiologist with an MBA and a BWI as a certified health promotion coordinator. He has a plethora of knowledge and experience with 40 years of service treating illness as a clinical physiologist. Since 2010, he has been promoting health wellness as the CEO, CFO of Healthier is Wealthier and Associates. In addition, he is a certified medical cannabis consultant, actively recommending cannabis to patients with a focus on health promotion and disease prevention. Thank you, Dr. Smith, for being here today.
My pleasure. Thank you.
Okay, so we're going to start the panel off with asking each of our panelists here today what sparked their interest in transitioning to the cannabis wellness space. And we will start with Dr. Swathi.
Oh, great. Okay. So thank you so much for tuning in. I'm so excited to be here. So I have always been interested in holistic health and wellness. And in our final year of pharmacy school, we're able to do clinical rotations. And so I chose to do one of mine at an independent natural pharmacy out in LA, which is where I am now. And I had such a great experience, and I felt like I finally found my place in pharmacy. And so I asked my then supervisor and now residency program director and start the first ever postgraduate year one residency program specializing in integrative health. And so we kind of broke that down into cannabis, nutrition, and pharmacogenomics. Throughout that experience, I've had the chance to be at an independent natural pharmacy, so where I did my rotation, and then also at an integrative HIV clinic, where I served as the pharmacist on the team, but also started an MTM program there, so a medication therapy management program. And we also spent quite a bit of time teaching, so up to 5 credits a semester. So throughout that experience, I just started learning more and more about cannabis. I knew a little bit beforehand, but learning more and more, connecting with people in the space, learning about the endocannabinoid system, learning about the therapeutic potential, and it just completely sparked my interest. And now I'm headed down that place, and I'm very excited to be a part of that. And it was partially that, but then also partially the demand. We were receiving so many questions from practitioners, from caregivers, from patients, and from students that we had on rotation just about cannabis and the mystery behind it. And so that just got me very excited and passionate about the education for my Western trained colleagues, but also students and the patients and the caregivers. So I work with companies now, but I also work to integrate the endocannabinoid system and overall like holistic health and wellness into curriculum.
Okay, so I got started in the cannabis industry 2 ways, actually. I was dating someone that I am still dating. So I want to make sure I mention this because he holds this against me all the time that I never mention this. But he had said, you know, I really think as a healthcare provider, as a nurse, you should look into the medical cannabis industry. He called it medical marijuana at the time, and so I did start looking into it. And at around the same time, my grandmother suffered an aneurysm, and it devastated her entire life, her mind, her body. She was very active. She was 88 years old, drove, had a boyfriend, and was really respected in our community. So when she suffered the aneurysm, she ended up in the ICU. She ended up also going to short-term rehab, but ultimately coming to my home to live permanently. I figured this would be the way it was until she passed, which ended up being true. But within about a month of her being in my home, she wasn't participating in in-home therapy, physical therapy, and so they were really concerned that because she wasn't progressing, they were going to have to discharge her. And at the time, I'm a mother of 4. I believe my triplets were about 11 years old at the time. And my older daughter was away at Choate Rosemary Hall, so she wasn't in the home. So I was just and I was working, and I was overwhelmed with caring for my grandmother. So the idea that she wouldn't get better was just so overwhelming to me. And so I had to pray and ask God, like, how I could help my grandmother. And it hit me during my prayer, and this is why I tell everybody God's in the cannabis business, because God brought to my memory that my grandmother had said that she used to have to smoke a joint and take a bath just to get her body moving because she had severe arthritis throughout, and she was not traditional medications, over-the-counter things. They did not help her. And so I was like, okay, we'll get Grandma Hyde, and this is what we'll do. And I ended up having a caregiver who was a consumer. Her and my grandmother did their thing in the morning, and within a month, my grandmother, who previously was not walking, was wheelchair bound, was not eating, was aphasic, meaning she could not communicate effectively with us. She was withdrawn, obviously depressed. Within a month after starting to medicate with cannabis, we saw a complete turnaround. She began walking with a walker. She was eating. She was engaged with the family. And having had been a nurse for such a long time and primarily administering medications and never seeing that type of turnaround so quickly in any person that I had been caring for years, I was like, I really need to study this because, I'm from the hood, from the inner city, so I knew what weed was, and I knew that people smoked it and whatever, but I never knew about cannabis as medicine. I never knew about the science of cannabis. I found a school in Massachusetts, the Northeast Institute of Cannabis, that had a 12-course study of cannabis, and it dealt with everything from cannabis as medicine to the science of cannabis, and I learned about the endocannabinoid system, and being a biology major, I'm a science geek, so it was right up my alley. But what really struck me and really connected me to this industry and to this movement was the course that we took on how cannabis even became criminalized, how it became illegal, and realizing and learning about Harry Anslinger and that the laws that were initially put into place were basically racially motivated and financially, of course, everything's about money. But just to learn about the criminalization of Black and brown people over the years. And, like I just said, I'm from the hood, so I knew people went to prison for it. I knew people, but I never really understood the correlation between the destruction of our community up to the war on drugs that is still continuing to be a war on people. And so I really wanted to be a part of it, part of making a change, part of changing the laws, part of making sure that people have their records cleared, they're released from prison, that they're able to engage in this multi-billion-dollar industry, that people who were affected and most harmed by the war on drugs are those people, and connected with some organizations like Women Grow, like Connecticut Normal. I'm representing. That's how I got into the cannabis industry.
Thank you. All right, Dr. Smith.
I grew up in South Africa, went to the University of Cape Town, where I became an anesthesiologist and was actually asked to give the anesthetic for the world's second double heart transplant. That was when they stuck another heart.
Are you able to turn up your volume a little bit?
My volume?
Yes.
I'll do the best I can. Try that.
Try a bit more.
That's the upper limit that I can do. What I can do is
Okay.
get closer to the microphone.
Okay. Yeah,
Does
that works.
help you?
Yeah.
Okay. So double heart transplant was, there were only two of them done. I was the anesthesiologist for the second one, and I had a wonderful chief. So I went up to him and I said, okay, we've only done one of these before, and it's not in the textbooks yet. How much anesthetic do I give this guy? And he looked at me and he said, enough. And that was my first lesson in how to administer chemicals to a human being. You give them enough, not too much, because that overloads them and they suffer from that. Certainly not too little, because they wake up in the middle of the procedure. And having a patient wake up in the middle of a procedure is not a fun event. So that was probably the first thing that started getting me interested in things other than the art of anesthetics. I became a consultant anesthesiologist and was asked to do a locum at a cannabis clinic in San Diego when I'd moved to San Diego. And I said, well, I haven't done one of these before. All you have to do is examine patients and give them a recommendation for cannabis. And I thought, well, I'd better get to know this a little bit better. And subsequently, over the years, I studied cannabis, discovered that it is, in fact, four or 5,000-year-old drug. It's been known for a long time, and it does have beneficial effects because it patches up deficiencies in the human body to get us back to normal. So it builds up our physiology as opposed to depressing our physiology like most of the narcotics do. And over the years, drifted or aligned myself more and more with treating illness to promoting wellness using cannabis, because our lifestyle is changing and our uh, uh, biology is not keeping up with the changes. And that leads to a whole host of illnesses, not the least of which is chronic anxiety. I think that PTSD is related to that. And cannabis in the right dose, in the right form, is a very good treatment for those patients. So I shifted from treating illness to promoting wellness using medical cannabis.
So I'll start with Hebra. You wrote a very passionate article in Canna Health Digital Magazine where you were discussing the war on drugs was actually a war on people, um, which more so affected the Black and Brown communities. So could you more so elaborate on that and provide your perspective on like how you're advocating in this capacity?
I wanted to talk about it. And the title of that article was Opioids Are Not the New Crack, because I think I had heard conversations of people relating the two, which is true. They were relative, but what was different was how people were treated and how, things went. Because when we're talking about the war on drugs and the war on people, we're talking mostly about the crack era and how, and so in that article, I talked about how for the first time ever, the health disparities, the racism that exists in healthcare, and the prejudice of some providers really kind of worked in the favor of Black and Brown people in regards to the opioid crisis, because, we weren't the ones easily given prescriptions for opioids, because the prejudice or the thought was that Black and Brown people are more likely to abuse them and become addicted. Black and Brown people are more likely to divert them and sell them. And so we were actually saved by the very thing that has caused our communities to suffer, and that's healthcare disparity. So unfortunately, the opioids were pumped into suburbia. And when it became a suburban problem, even though, let's be clear, we all know just that the crack epidemic affected all people across all walks of life, and it was not just a Black and Brown thing, but the perception has been that, as evidenced by the way it was handled, because during the crack epidemic and the war on drugs, Black and Brown people, whether they were the addicts, whether they were the drug dealers, they were both put in prison. Now we see with the opioid epidemic a more sensitive and human approach in the way in which they interact with people who have become addicted to opioids. And not to say that is absolutely the right way that it should be handled. And it's unfortunate that people of color weren't handled in such a way. And so, just really highlighting those differences, not because I'm angry or anything, even though I am a little angry, I gotta be honest, but because of the fact that I think it's important to see what we've done wrong in order to fix what we do in the future.
And how have you specifically participated in this advocating role within your community?
Sure. Yes, so I mean, I definitely believe that because of my work in this industry, it has given me a platform for advocacy, and specifically regarding the war on drugs, just highlighting the wrong and
Right.
making sure that other communities are told never forget, never let them forget what they did to you. But in our communities, in impoverished communities, Black and brown communities, we're told get over slavery, get over being targeted and having your families broken down. And it's just not fair, and it's not responsible, because we can't just get over it. We need therapy, we need help. And so I'm able to do my portion by highlighting those things, making sure that people know that they can get help for some of the wrongs that have happened to them, whether it's through therapy, whether it's through criminal justice, and then providing access to safe plant-based medicine, so that if someone has their card, they're not able to be criminalized. They're not able to be kept away from their medicine. And so opening Canna Health and owning these clinics has been my effort to help on a healthcare basis, but then being a part of CURE, Connecticut United for Reform and Equity, and being on the National Cannabis Industry Association's Equity Inclusion and Inclusion Committee, and being a part of MCBA and their healthcare committees, and being a part of the Cannabis Nurses Association's policy committee and diverse. These are all things that I'm doing to make sure that our communities are represented.
So my next question is for Dr. Smith. With your history of practicing as an anesthesiologist and now as a medical cannabis consultant, can you compare and contrast the approaches to patient care, including like when you were an anesthesiologist, how you dose the patient, and now when as a medical cannabis consultant, how you dose patients?
The nature of the chemicals that we put into a human body changes how the human body is going to react. As an anesthesiologist, I used to give chemicals that depress physiological function, depress the level of consciousness and they go to sleep, depress the level of movement and they're paralyzed. And there are pronounced toxic effects from anesthetic chemicals. We see and hear it daily. Somebody had an anesthetic and died while under anesthetic. As opposed to the cannabis industry and medicating, well, putting that in parentheses, recommending cannabis. Cannabis is a natural occurring chemical in the human body and sometimes gets deficient, resulting in PTSD, resulting in chronic anxiety, resulting in a whole bunch of symptoms, and those symptoms are decreased by giving patients the right strain of cannabis, and there are lots of strains and multiplying almost daily, but when their endocannabinoid system is rebuilt with exogenous cannabinoids, that's cannabinoids that they take, and so their endocannabinoid system is regenerated and replaced, they are better able to function in a normal physiological way. They work better. All parts of their bodies work better, and the diseases that they have complained about and suffered from are depressed. So one is a depressant, narcotics, and the other is an elevator replacer, the cannabinoids. Does that answer your question?
So then how do you go about, I know that we talked about this previously, how do you go about like dosing patients then?
Good question. As we've spoken about, there are lots of different strains. What I do in California, in San Diego, is I give a patient a recommendation to go purchase cannabis. I don't specify the type or the strain or the amount, because I think that it becomes a science project. I recommend that they go to a dispensary and speak to the head person there, not the little guys behind the counter who are strictly salespeople, and tell him what is going on with them and ask him what he suggests the patient tries. And then I have this wonderful thing. They need to then start slowly and build slowly. By that I mean that they get a, the, a they get advice from the guy of what they should be trying. There may be a dose related there. They start with the lowest dose they can. And as an aside, I heard of a story yesterday of somebody who tried the cannabis and went to the highest dose recommended and is now coming to me for guidance on what to do. So start low, build slow, and keep a record of how they feel. And there are only three possibilities in my mind. They feel better, in which case the endocannabinoids that they're taking are supplementing their own endocannabinoid system. They feel worse. It's the wrong drug for them. Stop it immediately. Go back to the dispensary, speak to the guy again and say, this doesn't work for me. What else do you have? There's a lot to choose from. Or finally, they don't know. They can't make up their mind if it's good or bad. Well, then carry on doing what you're doing, because if it's not helping and it's not hurting and you have a year's supply, carry on. My idea for them is to find the right strain and the right dose for them. And for me, I call that a science project. We are all different, and what works in one of us may absolutely not work in the one person standing next to us.
Absolutely. Thank you. So, Dr. Swathi, so how did you become interested in the cannabis and wellness space? How did you become interested in the endocannabinoid system when I know that it's not necessarily emphasized in medical school or pharmacy school, or I know Kibra and I think we talked before, it's not, we weren't taught that in nursing school. So Dr. Smith, what about yourself?
Absolutely no instruction at all in medical school, none.
Right, and I have heard like even the little bit of knowledge that some schools are doing with the endocannabinoid system. It's very limited and students aren't tested on it, so they don't focus on it as heavily. So tell me, how did you become interested in the field then?
For me, it was learning about it. Starting from the beginning, learning about it, started that process, and the interest in plant medicine and holistic health and everything throughout pharmacy school, but really kicking that into high gear during the postgraduate year and during that residency training. And working with my now supervisor, residency program director, she has a very big passion for plant medicine. So hearing her talk about it and then going through a lot of the pathways and talking through it with her and other students, it's just so unparalleled with the possibility. And it's just so incredible to keep learning about all the new research and everything coming out. So it's really an ongoing learning process. In terms of it being in curricula, it's so disappointing that it's not in curricula yet, because it's just another system, even though this system does interact with so many other organ systems. It's just so disappointing that it's not in the curriculum now, and that is due to what Kibra was talking about before with the way that it has been criminalized in the history. But slowly but surely it is changing though. As you mentioned, there are some curriculum that are starting to integrate it, whether that is through electives. So I'll be part of an elective at UCSD School of Pharmacy. They're studying in medicinal cannabis, actually started a few weeks ago, a medicinal cannabis elective, medicinal cannabis and pharmacology. I think it's called, so I'll be guest lecturing on integrative health and the intersection with cannabis. So very excited about that, to get to talk to the students and hear their perspective and everything about what they're hearing in the research and then talk about it with them. So slowly but surely it is happening. There are other programs, like there's a master's program through the University of Maryland, and that is focused also in a school of pharmacy. It's the University of Maryland School of Pharmacy. And they have an entire 2-year focus, and you come out with a master's program. And they started their first cohort in the fall. So I know a few people going through that program. So hearing their experience too, working with a lot of other different clinicians, but also some lawyers and people in all different fields, bringing their perspectives together.
So speaking on the same topic of education, Dr. Smith, how do you incorporate education to your patients, especially those who require a little bit more convincing, or they're skeptical about cannabis as a medical therapy? How do you educate them?
I start off by asking them if they've ever used narcotics and how they've reacted to narcotics, and get a feeling for how sensitive they are. And then ask them if they know anything about the endocannabinoid system, and then slowly bring the discussion from what it is, how it works, the history behind it, Dr. Raphael Meshulam's experiments, and that sort of information. And then tell them that as far as I'm concerned, and I know, there is no toxic effect from using cannabis. Yes, you may feel sleepy and you'll sleep it off, but unlike narcotics, there is no toxic effect from it. And then offer them the opportunity to try. And that by itself seems to be the easiest way to get them to change their mind once they see the difference in them. It's like going to a dinner party and they serve something that you've never tasted before. And you say, what's that? Oh, that is a new recipe that we're trying that it's wonderful. And you sort of look around and you say, well, let me try some. I think that that is the easiest way to get anybody to try cannabis, because most people out there, oh, I've heard some terrible things about it. It's poison and it's terrible. God forbid, don't come anywhere near me with that stuff. Well, what if I told you you had an endocannabinoid system in your body right now, which is working and telling you no? What do you mean? So it's a change. It's a change in the dialogue and getting them to understand that, yes, it may be out there, but it's also very much in here.
Kibra, can you elaborate a little bit more on PTSD, how it affects families and individuals? And with your clinical experience, why has cannabis alleviated some of these symptoms?
Yes, so PTSD, I always say it's, for some people it could be one event, but for most people who grew up in poverty in the inner cities and communities of color, urban trauma is what I like to refer to it, even though clinically in the DSM-4 it's listed as PTSD, but our communities suffer multiple traumas. And one of the acceptable qualifying diagnoses in the state of Connecticut and in many states with medical cannabis laws, the diagnosis is PTSD. And so, most often when people come into our clinics, they're looking to kind of like game the system to an extent, and they're like, what do I have to say to get this PTSD diagnosis? And I'm like, you just have to say the truth. And I present them with what we use at Canna Health is a PTSD evaluation and assessment tool called the PCL-5. And it basically is a 3-part questionnaire. And the first part is about experiences. So it talks about the different things from natural disasters to domestic violence to physical assault to a car accident. It could be a variety of things. And so people are finding themselves checking off like the majority of the boxes because they've been experiencing all these things. And then the next section talks about the worst event. And then the last section talks about symptoms. And so when people are actually checking off, yes, I don't sleep well at night. Yes, I am irritable and I don't know why. Yes, I do have a problem keeping a job and forming relationships and things of that nature. And by the end, they realize they are not gaming the system, but more like they have been a product, and they realize that they have these traumas, a product of growing up under these unreasonable war-like circumstances, and so so that is what we do at Canna Health. We are illuminating people to the traumas that exist in their lives, and we're allowing them and affording them the opportunity to learn about medicating themselves with cannabis. Many people have been self-medicating improperly, and so it's important to teach people about different strains and terpenes and cannabinoid profiles so that they're able to actually match their symptoms with the abilities of each strain. And, like I always say, like with terpenes, anything with limonene just makes you happy, So, those kind of things, like if you're depressed and so being able to highlight those things, help people understand why they're medicating, and then finally referring them to therapy, and helping them get the help that they need to heal. And I not only do that by providing referrals, but I talk openly about the fact that I'm in therapy, and try and normalize it and make people understand that this is something that is necessary. What we live through, especially us 90s people, what we live through, no one should have hundreds of their classmates murdered, throughout their high school career. No one should have these things. And so what we live through is not natural, it's not normal, and the effects that it has had on our lives have become normalized, but they're not normal either, and there are ways to correct that. And so, educating about PTSD, helping people get help, that's also a form of social justice, and really kind of beginning to start these conversations about what was wrong, what was done to you was wrong. And so what the results that you're living with, the choices that you made were based on that wrong and those traumas. And so you're not a bad person. Bad things have happened, and helping people to come out on the other side better.
Dr. Swathi, how do you incorporate the endocannabinoid system and wellness into your practice as a pharmacist?
Okay, great. Yeah, thank you so much for asking me about that. I want to start from the beginning and define integrative health. So how I define integrative health is the combination of conventional pharmacotherapy and the quote-unquote unconventional therapies together. So conventional pharmacotherapy is your prescription medications and things that you've been recommended by your doctor that you would need a prescription for. And then the other side, that unconventional side, is all the other modalities that can make up holistic health and wellness, or how I think about that. So that could be anything from homeopathy to natural medicines, cannabis, and then meditation and mindfulness is very important, talking about nutrition and lifestyle overall, and sleep hygiene too. I talk a lot about sleep hygiene. So just putting all of those together, I think you get a really good sense of the person and treating the whole person. And so I try to do that at the independent natural pharmacy. It's more of like a consult kind of service. So the patients or the customers will come in and kind of look for someone to chat with, whether that is a pharmacist or any other practitioner that is employed by the pharmacy. So they're naturopaths, herbalists, acupuncturists, nutritionists. And so sometimes they come in knowing they want to talk to the nutritionist. So they go straight there and they talk to her. But sometimes they come in and say, I have this ailment, I've been having this issue, and it becomes a bigger conversation where maybe it's the pharmacist, but it's also other practitioners working together as a team for the patient. So it's a really different, unique experience in that way. And then at the HIV clinic, I work with an interprofessional team also. But even when I'm seeing patients one-on-one or fielding questions from the team, I'm always thinking about how all of the modalities can work together. And perhaps if this patient isn't sleeping well, maybe I just talk about sleep hygiene, how that can help them. Or if a patient comes in and has questions about their diabetes medication, then I can talk about nutrition and how that can help them, and starting with lifestyle. So it really is very patient dependent, but I try to look at it from a lot of different vantage points to try to help the patient.
So it's like you're treating the whole patient instead of treating the disease. Absolutely.
Yeah, and that was something I felt that was missing from the curriculum in pharmacy school. I was constantly searching for that, or if it was, for example, like going back to diabetes, I guess, if we were talking about, okay, you talk about lifestyle and then you go into the medication, but we never fully talked about what lifestyle meant and how we would go about that conversation and what that would mean for the patient and their quality of life overall. So that's been a very big learning curve, but in the best way though, and something that I've learned throughout the process of training and specializing.
So then what would you say, I know that you say that you use a number of different like modalities, or you consider a number of different factors when you are providing patient care to a patient. So then how would you respond to someone who feels like cannabis is the end all be all? Like, there are some people who say, oh, the fan's broken. Well, then just, smoke some cannabis. It'll be fine. Or, the floor is dirty. Clean it with cannabis. It'll be fine. So basically, obviously I'm over exaggerating, but, like that grandmother is like, just drink some ginger ale and have some graham crackers and or saltines and you'll be fine. But this says my grades are low. Drink the ginger ale and the saltine, your grades will get better. So what do you say to that? Because it seems like your approach is a combination of, again, traditional and non-traditional medication, I guess, approaches to care.
Yeah, I think it depends on what perspective the patient is coming from and what their background is, and then also what they're exposed to, whether that's through the media or through other patients or other family friends or family that they've talked to that have gone through the experience. So you really have to kind of frame it depending on each patient and the perspective that they're coming from. But then even from there, I think every modality has its place. So I would try to explain that in the best way possible of, yes, cannabis can be great for this, but maybe if you've just had like a heart event or something like a heart attack, maybe that you do need to be on certain medications and cannabis is not the best choice to start. So it really just depends, the other diagnoses, the other medications the patients are on, their lifestyle, their diet, and how they want to integrate cannabis into their life, and also their overall treatment goals. I think that that's really important. So being able to have a collaborative discussion between me or the practitioner, whomever they are, with the patient and working together as a team. And so what we call that patient-centered shared decision-making. So the decision is made between the two parties, but the patient is still in the center. So we want to treat the patient as best as possible with what they want and achieve their goals.
I mean, but there are some people who have found that cannabis is their end all, be all. They might, listen, I was putting cannabis salve in my hair, so I'm one of those people. But,
That's
like
a confident person to say that they've been putting cannabis in their hair. Strong belief right there.
Hey, look good.
I mean, has there been an improvement?
Yes, I mean, and that's what I'm saying. Yes, we have to be thoughtful about it. I think as a nurse, I come from a little bit of a different perspective in the way in which I interact with patients, and so it's just important to just let people believe what, if they believe that this is working for them. Half of that is mind over matter. And just teaching people about the things they should be worried or alerted to. Like, for instance, if someone has had a cardiac event or is hypertensive and is on medications and they do want to start medicating with cannabis, it's probably it always is a good idea to speak to your provider about it and to come with information, because a lot of providers have no idea about cannabis, but it's important that, you know, when you learn that cannabis is a vasodilator. So you know that if your veins are open and blood is flowing, you know, it's going to help to decrease your blood pressure. So those are things that you want to be thoughtful about and mindful about, and talk to your physician so that you don't end up hypotensive and have to be hospitalized or have some sort of event.
Mm-hmm. Yeah, and I mean, there's really great research with the placebo effect too. So I think that that probably plays a big role in the patient feeling better and the patient maybe gravitating towards different modalities over another.
That I'm going to post to the group is, what is your stance on tolerance versus dependency versus addiction when it comes to cannabis?
Okay, I'll jump in there.
Okay.
I definitely believe, so people always talk about addiction regarding cannabis. I believe more than anyone is ever addicted is that it's an effective medicine. It works, and so people continue to use it. Your body, your endocannabinoid system does adapt to your use, and so in order for it to be effective, you may have to increase the amount that you consume, but that does not indicate addiction. I think there's some studies out that say about 9% of the population is in the United States is addicted to cannabis. I don't even think that's true. I think the majority of them are just chronic users because of its effectiveness, and that it helps them live their lives on a daily basis. And so that's my thoughts on that.
Well, what about the cannabis use disorder, CUD?
So yes, there is a diagnosis, cannabis use disorder, that people, I have seen it when I've gotten referrals to come into our clinics, that physicians will say this person has cannabis use disorder. And I just think oftentimes you'll find that those are the physicians or the clinicians that give those diagnoses, because it could be a mental health provider and, a physical doctor, I find that a lot of times they don't understand cannabis use. And again, that effectiveness and the long-term chronic use that is associated with cannabis use is misinterpreted as addiction. Their inability to medicate themselves properly because of lack of knowledge about cannabis further kind of supports that idea, because a lot of times people are over-medicating themselves, which I think can lead to that diagnosis. But I do believe with the proper education and with understanding how the plant works in your body as an individual, combats that. And I really ask people who are coming in to get certified that they go back to their doctor who has given them that diagnosis and ask that that be removed from their chart, because ultimately they're saying they're addicted. And that might not be something they want going forward.
And that goes back to the multi-level approach to education too. So we want to educate the patient, educate the caregiver, but also if we're going all the way back and starting at the bottom, like root level, starting with the students and going from there. So it's just so important to have education on so many different levels. So I'm glad you talked about that.
So it's a mindset.
That goes
people.
And that goes to my discussion as well, that as opposed to narcotics are obvious depressants. You can take a normal subject, a normal patient, a normal child, and give them a narcotic, and they will be depressed. They'll go to sleep and their physiology goes down. There is no known overdose of cannabis. None whatsoever. The worst that can happen to anybody is they go to sleep and they sleep it off, and the next day they're back to where they were. So cannabis is a replacement for a deficit as opposed to a depressant of normal function. And if you are replacing a deficit, The toxic effect is enough. That's all. It requires paying attention to what you're doing, following up, diligently following up. I'm giving you this. There are side effects. You may feel separate, so forth. Start low, build slow. I know I've said that often. That's my mantra.
Mm-hmm. And mine as well. And to piggyback off of what Dr. Smith said, oftentimes when patients come in, especially if they're new to consuming cannabis, but even if they've been, again, people that have been misusing cannabis for forever. So, helping them understand. But I always tell patients to get a journal and to write down the strain that they're attempting or trying to manage their symptoms, and then writing the effects and the amount, so that they're really understanding, okay, so this particular strain gives me a headache. There could be some adverse reaction. This gives me way too much dry mouth, or whatever. And so you might want to find something different. There are expected side effects, but but there are also ways to overcome those side effects by trying a different strain. As Dr. Smith said, there are hundreds and probably thousands at this point strains. And so we have choices, as far as what we consume and how we can medicate.
Mm-hmm.
Absolutely, yes. There are hangovers of expression from the good old medical pharmaceutical traditions. And nobody actually talks about enough. Oh, take 3 of these 5 times a day, you'll feel better. What do you mean I'll feel better? Well, you'll go to sleep and stop breathing and die, and you'll feel much better. But that's the medical profession today. And they are in it to sell product, not to promote wellness. Cannabis does promote wellness first by obviously selling product. And my way of talking about it to patients is it's a science project. Where is your endocannabinoid system bust up? And then how much do you need? And I think I said this yesterday, I may have said it earlier. A woman is coming to see me because she was on maximum doses of cannabis and was passing out. Huh? Surprised? Who's surprised? She's doping herself out of her mind. Nobody had said that to her. Anyhow, it's an interesting science project for me.
So my next question is around cannabinoids. So we know that cannabis, the whole plant, has over 100 of different cannabinoids, aside from THC and CBD. So in your clinical experience, all 3 of you, have you ever recommended a different type? Have you ever had experience with a different type? What's your take on just the majority of media focusing on THC and CBD when there are so many other cannabinoids that actually have health benefits?
I'm totally pro whole plant. I believe in the entourage effect, which talks about all the cannabinoids working together to produce an expected or desired effect. So yes, the society has only broken it down to, THC that gets you high, the psychoactive effects, and CBD that doesn't get you high, but that has the body effects. And it's really not that simple. And one thing these cannabinoids work best if they work together, and a lot of times CBD companies specifically now are one of their main things that they will say is we're 100% THC free. And to a lot of society, that sounds like a great thing. To me, I'm like, oh, but it's missing parts to make it better. And so, really helping people understand that, yes, CBD can be effective as an anti-inflammatory and as a neuroprotector. It definitely has those qualities, but CBD with CBG and THC can knock out your pain, help you sleep, and deal with your inflammation. So what would you prefer? I would prefer the 1, 2, 3 punch than, having to go back and medicate with, people are taking CBD for the inflammation, but they're still taking a sleeping pill, or, they're still taking pain meds. That to me doesn't give you the quality of life that is what, I feel like cannabis can bring to a person's life and situation.
Finding out that even the plants that we thought had certain concentrations of THC and CBD, they are being changed depending on how the plants are grown. So
yep.
It's all very well to order or to prescribe something. You can't prescribe it, that's the other thing. It's against the law. So recommend a particular plant. They will go to a dispensary and buy it and get wonderful results, and go back to the dispensary and the results are different because the plant is different. It looks the same when it's sitting in a box in a dispensary, but it ain't the same stuff. Mm-hmm. And right. So, it's a science project. Every time, try it and see what it does for you. Mm-hmm. Mm-hmm. It's better, it's worse, it's the same.
Oh, no, I was just going to say that has a lot to do with the metabolism, too, and the way it's metabolized by the specific enzymes in the liver, the CYP enzymes. And so all of them it's primarily metabolized by 3A4, at least CBD and THC, but then there are all those other CYP interactions, like 2C19 with CBD, and then 2C9 with THC, and then all the other minor cannabinoids, we don't know those 100% yet. So I think that's a lot about personalized medicine too, and whether or not it's going to work for one patient versus another. Mm-hmm.
And I think we talked a little earlier too about terpenes, and the importance of that as well. So I think when we're looking at the plant and we're looking to medicate, looking at not only cannabinoid profiles, the terpenes that are involved, the method of consumption, all those go into the overall experience that a person has and the effect that they derive.
And when we first see a patient, their endocannabinoid system is in a particular setting in their body, in their physiology, because to react to their lifestyle. And when we give them cannabis as a medication, their physiology may be changing, so that their sensitivity may be changing, so that the dose of cannabis that we recommended the first time, either a month ago or a year ago, may be too much this time, and they're falling asleep, and it's terrible stuff. I hate it. Mm-hmm. It's up to us as the prescribers or recommenders of cannabis to keep watch on what it's doing to our patients and how they are reacting to us, because the dose is likely to change. And the strain is likely to change.
Okay, so my next question is on PTSD. So there has been like some controversy about legalizing cannabis too quickly because the properties are still, they say, largely unknown. So basically, they're just saying that there's still not enough research. And I tie that into PTSD because a lot of, I guess, states, even who are medical, like they're hesitant to include PTSD under like medical coverage, medicinal cannabis. I know Georgia was one of the states because that's where I'm from, or was raised. And so we know that a lot of vets and people don't really realize it. Like Kibra said, people don't understand that it's not just a veteran's thing. It actually can happen to them, but they don't really realize it because they think that maybe PTSD has to be some sort of severe, very severe, a bit whole, life-changing event. And not saying that it's not, but people don't recognize it because they always equate it to veterans. So back again to my question is, so how do you feel about when people say, oh, well, we don't want to legalize it too quick because there's not enough research, there's not enough evidence, yet the plant has been here for thousands, hundreds, thousands of years.
Sounds like a Dr. Smith.
Okay. The whole argument, I think, is a little bit crazy. If somebody suffers from PTSD, it doesn't mean that they've been in a battle situation. They have maybe have been in another situation which has brought it on. And I don't know what the situation is. I do know that the right strain of cannabis may relieve their symptoms, no matter how they're caused. I'm not interested in the cause, and therefore I'm going to deny people therapy because they didn't have the right cause to produce the symptoms that they're showing up with and complaining of. How they got them is how they got them. My job is to relieve them. And find the right strain of cannabis goes into the science project again. Will this help you? I, as a physician, am eager to try this to see if I can make you feel better. No matter what causes it. They may have had PTSD from a car accident. They may have had PTSD because they grow up in a household with that's the only behavior they learned. That's not for me to decide. For me to decide is what dose and what strain of chemical can get their endocannabinoid system functioning better. Does that make sense to everybody?
Absolutely.
Yeah.
Yeah.
Absolutely.
But I think too, like we have to think about how people perceive mental health in this country, specifically in certain communities, specifically in communities of color. It's almost like it's not a real thing. You know, people like to sweep mental health under the rug, and I believe it's because it's not like, you know, it's not like a heart attack, let's just say. You know, you never know how a situation is going to affect a person. Someone could go to war, witness witness, you know, the casualties of war and be perfectly fine. There are people who are actually saying that they are perfectly fine, and clinically it appears to be that way. But there are people who that will devastate the rest of their lives. And so I think because it's so subjective and because people can't put a finger on it and feel like the results or the consequent or the subsequent results can be manipulated, that they tend to want to not validate that. But the truth is the truth, and there are plenty of people who suffer from PTSD. You know, I remember reading about a young lady who wasn't even born when 9/11 occurred, but she watched videos of 9/11 or saw events, and she literally was diagnosed with PTSD from watching recordings of the 9/11 event that had occurred before she was even born. You know, and I believe her. Like, I don't believe that it's affecting her, and we shouldn't just sweep it under the rug because we don't understand it or because we can't relate to it.
Good question, good situation. I think as a physician, I cannot go around prescribing cannabis for a suspected PTSD because of the story they give. Somebody has to complain.
Symptoms.
They have to have symptoms. And then maybe I can help you with your symptoms. But if they're walking around feeling fine and they have a history of doing all kinds of things that we turn our eyes up and throw our hands up and say, oh my God, how did you survive that? They did. The bottom line is they did, and they're not complaining. When they complain, I may be able to help you.
Right, and that all comes back to clinical. Oh, sorry.
Go ahead, Dr. Swami.
Okay. So I was just going to say that all comes back to clinical discretion, and I feel like that's something we talk about all the time with our students, because We talk about a lot of dietary supplements. We talk about natural products. We talk about homeopathy. And there isn't as much research as what we're used to with the prescription medication. And so going through those studies and evaluating what has been done before, but then using clinical discretion as a clinician to decide what is best for the patient and what suggestion you are going to give. So yes, definitely, I agree.
So how do you guys feel about the research aspect? I mean, we're always saying that we don't have enough research, we don't have enough research, we don't have enough research. So do we have enough research or do we not have enough research?
Research.
Kibra, I can't hear you. Can't hear you.
I definitely believe that there is need for more research. You know, prohibition has some ugly consequences, you know, and one of them is that it was federally illegal to openly research this plant, even though we know the United States government is full of hypocrisy and that they've been researching this plant in Mississippi, University of Mississippi for decades now. But because of the illegality.
Right.
The government has a patent.
Yes. U.S. patent number 6630507.
There you go.
Ridiculous.
Irony.
Yes, but I believe because of the fact that it's been shown that the United States has been researching this, they need to change those laws. But Canada is doing a lot of research. Israel, Dr. Mashalom, you know, he basically is the father of research in the endocannabinoid system. And so, research has occurred. There's a lot of studies out there, many anecdotal stories that I don't think should just be dismissed. But yes, there should be more research. There should be more focus on understanding how cannabis affects the brain, especially the developing brain. You know, those are all areas of concern. I have 3 18-year-olds. So, you know, I talk to them about cannabis. I don't want them to consume if it's going to have long-term effects. And there are areas that I'm not 100% sure about, even though, again, as Dr. Smith had mentioned, people have been consuming cannabis for thousands of years before Christ. And still no one has died, you know, still no. And I know people who were consuming cannabis since teenagers, and they're like, they're functional adults, you know. So I believe that there's reasons to look at what's happening anecdotally, but while we have been limited, but now's the time to start these research programs and be a party to them.
Yes.
Absolutely. Okay, so my next question is, how do you suggest a patient approach their hair care specialist? What? How do you suggest a patient approach their healthcare provider when wanting to introduce cannabis into their lifestyle? Like, what suggestions do you have? I know it's a difficult conversation, so how do you start that conversation? And then what happens if the practitioner says, no, I don't do that?
Come and see me. I think that they need to be made aware of the differences in attitudes amongst physicians, number one. And ask their physician, what do you think of cannabis, and recommendation of cannabis? And if their physician says no, can you recommend one for me? Again, no, then speak to their friends. Then they've got to make a decision. Do they want to maintain that physician or totally switch allegiances to another medical practitioner?
Mm-hmm.
Now, there are some cases where they may not be able to do that because of the health problem that they're experiencing, that that physician is taking care of. That is another story. Men going to gynecologists, not a good idea. But but you get the idea. What they're complaining about and how they're using the medical system is very individual, is what I'm saying. And
Right.
they've got to ask their physician, can you help me? If they can't, find one that can.
Mhm.
Absolutely.
And I suggest too, when patients go to their physician, that they come armed with some information, to assume that the doctor doesn't know anything about cannabis, but because cannabis is the one medication that we've talked about that patients actually have autonomy and control. And so part of it is the responsibility to be educated about it. And so I tell patients, go to your physician with information about cannabis, with information about your diagnosis or your symptoms you're attempting to manage, and show your doctor what you found about how, because there's a reason why you want to try it. So show the doctor what your case is for it. And if you have a doctor who is concerned about his patients and wants to respect their wishes, then they're going to be open to the conversation. And if they choose not to certify someone for medical cannabis, because a lot of physicians do choose not to certify, but they're okay with it, so they'll refer them to a medical cannabis certifying center or a doctor or APRN who specifically does that.
Right. I agree with you.
Yep. And I would also add, so finding that specialist that will actually help you, whether that's your current practitioner or a new one, going prepared, but the other one being to take notes and that active participation during the appointment, I think is really important. And then Kibra, you brought this up before too about journaling with everything that they try, when they've taken it during the day, how many times they've taken it, how they felt. So just playing that role and continuing through.
Yeah, I know Dr. Smith and Keeper both mentioned journaling, and Dr. Swathi is mentioning it too. So viewers, that's definitely a consensus there, and it makes sense for you to understand your body and how you react to it. But also, I wanted to ask Dr. Swathi. I know that we were speaking about. You said that there was a study that you did where you were talking about if patients talk to their healthcare providers about the use of cannabis, and you said that it was so low and that you need to increase that. Can you elaborate a little bit more on that?
So this past semester, I had the opportunity to work with some College of Pharmacy students. And so they have this program where they finish all their clinical rotations by the end of December of their 4th year, and they have 4 months to do a research project. So I had a chance to lead that project, and so what we decided to do was evaluate patient perceptions of safety and efficacy. And we did that through surveys. We did an IRB and everything through their university. And so we conducted that study from January until last week. So right now we're working on the abstract and everything to get that submitted. But what they found, though, is that only 6.3% of patients talk to their pharmacist or provider about their cannabis use. And something that we've always said with our students, when we go and lecture, is that the most dangerous supplement is the one that we don't know about. And we just need to know as much as possible to get that full perspective of the patient before we're adding on anything to their regimen. So that was very telling.
Yeah, and I think Dr. Smith, you said when we were on break, you said a really good kind of analogy in terms of aspirin and a provider, and a patient having an allergy to aspirin and the provider not being able to accommodate that. Could you elaborate on that?
Yes, I think that one of the things that I learned about cannabis that I found very, very useful was that we as physicians cannot prescribe this at a federal level. So I think that we are duty bound then to explain what the effect is likely to be. And I take that over to, yeah, I think you should take 3 aspirins and I'll see you in the morning. what is the aspirin going to do to me? And what can I expect will happen to me? Unfortunately, the medical profession isn't taught this, isn't made aware of it, and never practices it. But we are taking human beings and putting chemicals into them for certain outcomes that we expect, and we don't tell them anything about what they are likely to anticipate. And some of the stuff that we recommend, cannabis excluded, are very, very toxic. And I think that if you write a prescription, you are duty bound to explain to the patient what they might experience, particularly when it's something which is going to affect their psyche in one way or another, affect their memory, affect their ability to concentrate, affect their ability to move around. I think it's very important that that prescription, rather than here, take 3 of these 5 times a day, you'll feel better. I think that is what a lot of physicians do, that because of time, and don't ask the correct questions of, have you ever used this before? What happened? We are guilty of that as a profession.
And then you were also elaborating on during the break, what happens if a physician, like if a patient says, oh, well, I'm allergic to aspirin, and then the physician isn't accommodating. So you've related that to finding someone who's accommodating for cannabis. So if we could kind of correlate that to our viewers so they can understand more so how to find a good practitioner that can work with them.
How to find a practitioner, I think, is very difficult, maybe time consuming. First of all, ask your buddies. Anybody been to a cannabis dispensary around here? That's the other strange thing. You don't go to a cannabis pharmaceutical agency, you go to a dispensary. Anybody around here use cannabis? Anybody been to a cannabis dispensary? What are they like? How do they treat you? I have to admit that some of my best friends work in a cannabis dispensary in San Diego, and they are smart, intelligent, funny, witty, kind-hearted people. And they don't take anything for granted. If I walked into a dispensary and somebody didn't ask me what's going on with me and why, what am I allergic to, I'd be very, very suspicious of the whole operation. Are they interested in me, or are they interested in them making money? Now, if they're simply interested in them making money, they are not going to pay much attention to you and your whining and complaining. Why should they? Does that make sense?
Yes.
It's kind of harsh, isn't it? But it's the same with pharmaceuticals. If a doctor recommends something to you and you have a bad reaction, I think you're duty bound to tell him that you've had a bad reaction, and it's up to him to either say, stop it immediately, try something else. Because we as physicians are more interested in getting you well and better, not making you sick.
Absolutely.
Right?
Absolutely. Absolutely. Okay, and then so we will end this panel by asking this question. So if a clinician or anyone interested in the field, any medical professional interested in coming into the cannabis and wellness space, anyone who is interested in coming in the cannabis wellness space, how would you, what advice would you give to them on entering the space in general? Like everyone. Group question.
Nobody. Okay. So
the first question to them would be why.
Oh, your first question to them would be why? Really?
Yes. Why do you want to get into that space? What drives you to take what is commonly known as a horrible, bad, and toxic substance and make a practice out of recommending it to other people? What's driving you?
Good question.
And
And
for,
then
for
depending
me,
on
with
their
advice,
answer,
Go ahead, Dr. Smith.
carry on. Once they've got the answer, be honest about it. I'm not that kind of a doctor, or I don't know enough about it, or why do you want to know? I want to know for my own safety. Yeah. Why do we have a narcotic a massive narcotic overdose phenomenon in this country? People dying of narcotics, an opioid epidemic. Huh? Who's prescribing that stuff and why? And they aren't paying attention. I think the same rules have to apply to cannabis. I do supply the same rules as they do. Have you ever had it before? What's its been its reaction to you? How many different types have you tried? Oh, how many types are there? There are 1,900. Which one would you like to try first? You know, the prescriber has an obligation to the patient, and they have to honor that obligation. And I think it's quite okay for any physician or other healthcare practitioner to say, I don't know enough about it. Phone my buddy, phone this place, I can't help you. Even though it's going to cost me $125 a visit.
And for healthcare professionals, especially other nurses who come to me and they're interested in becoming a cannabis nurse or looking into the industry, I always suggest that number one, that they find a network of people that they can, professionals that they're able to feed off of, to be able to bounce ideas off of, and to really be able to expand your knowledge in the industry. I also highly suggest that people become educated, like, okay, don't just put up a sign one day that you're a cannabis nurse or, you know, you're a certifying physician, but actually take a course, read a book, study, get a certification. It may not mean much in the world, but it'll mean something to you to be able to have that knowledge and be able to effectively share that knowledge with your patients. And so after the network, the education, then like find what your niche is, like find where you fit in this industry. I was a behavioral health nurse primarily. I primarily worked in home care. This was right up my alley, like meeting people where they are and being able to help them see things in a different way, especially old habits. You know, I remember as a home care nurse, I would go in and I could smell the fried chicken in the air, but I know you just had a massive heart attack, you know? And so, you know, really being able to help them understand, you know, how to, as Dr. Swati said, care for the entire person. And so, you know, that is important when you're in this industry, because you're, especially as a healthcare provider, because you're not just dealing with chronic diseases and symptom management. You're also dealing with socioeconomic issues. You're also dealing with educational or lack of knowledge and information issues. You're also dealing with societal issues. You know, sometimes you're dealing with religious issues. And so you really have to understand the community and the people you're serving, and because this is a multifaceted, multi-issue plant. You know, it's just a plant. It ain't never killed nobody. But, you know, because of how complicated things have been made to be, you know, it's important that you have knowledge and information.
Well spoken.
I couldn't have said it better than that, so I'm going to leave it with you.
All right, so I am ending this panel. Thank you so much, panelists, for lending your time and your knowledge. We greatly appreciate it, especially during this unprecedented time. So thank you again for your time.